Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. The patient in this procedure is actually a regular client of mine. However, since I last saw her, she's developed dementia. As part of her dementia, the patient's very unstable and the patient gets very anxious. And so this procedure, we performed a domiciliary visit because the patient's not able to attend the clinic. So we're at our house where she feels a bit more comfortable. Her son, her primary carer, was there also in attendance. It was a very difficult case because the patient just found it very difficult to stay still. So initially we had to almost acclimatise the patient to the procedure again. You can see I'm just being very cautious, although this wax is near the entrance. I'm almost anticipating the patient moving and preparing myself to leave and exit the ears just in case the patient makes any sudden movement towards me. However, the patient's becoming a bit more comfortable now and the patients are getting acclimatised to the noise. It's generally the noise that can put people off. Microsuction is quite noisy. The patient had been using some olive oil drops prior to me attending. I did advise her son, the carer, to put some drops in just to facilitate the extraction. In the past, her wax removals have been very, very complex because they haven't been using drops in advance. Now, given the patient has dementia, she's very unsteady and stable. For most patients who are very unsteady, I would have left the procedure as it is at the moment because the main occlusion's gone. You can see the tympanic membrane in the distance. However, the patient also wears hearing aids, and one of the issues are that her hearing aids whistle feedback if there's wax. So if you have earwax, the sound that's amplified into the ear via the hearing aid hits the wax, reflects back out, re-enters the hearing aid microphone. The hearing aid reprocesses the same sound and we get a feedback loop. It continuously does that. And a feedback loop causes the hearing aid to squeal. And also, wax like this, soft wax, can block the sound tube on the mould. You see the patient just a bit unsteady there, so I've just come back out. I'm just analysing this wax, and it's on the anterior wall and it's on the bony part. So I'm just asking myself, is it possible to do this safely? In a moment, I'm going to use a fine end tip. So the fine end's a bit quieter. I've got a bit more manipulation with it. And I'm just trying to stretch her ear a bit wider so I can get the right position. And here we go. So fortunately the wax is a bit soft. This is actually a bit more keratin, I would say, dead skin that's not shedded. Here we are. I'm not able to get all of it out, unfortunately. I just didn't feel safe, but I got as much out as I can safely as possible. And the rest of the skin, I would have to peel it. I would have to peel it towards the eardrum, and the patient wouldn't have been still enough. So I'm happy with that. I'm not going to try and attempt to get any more deeper in the ear on the bony part because it would just be too risky. So this is the same patient at the left ear. So I've been using less drops on this side. This ear wasn't as occluded. It was, I would say, semi-occluded. But again, you can just see there, the patient is moving slightly. You can see the wobble on the camera. So I'm just using a standard Zollner suction probe. I thought this type of procedure is good to show viewers because quite often we we treat elderly patients who have either got Alzheimer's, dementia, or learning difficulties, or they're autistic, or have ADHD, and some of these patients find it difficult to stay still, and that poses a challenge for us. And you're just going to be really careful, very cautious, acclimatise the patient to the procedure, get them used to it, don't just go straight in, keep reassuring them, and if you feel the patient's going to move suddenly, always be ready to come out as quickly as possible. Try not to get every little speck of earwax out, because by doing that you can unnecessarily cause trauma. Try to alleviate the symptoms. This is a bit, as I said, a bit of a complex one in the sense that the patient has got a hearing aid and we don't want any residual wax where possible to interfere with the hearing aid. So because this is a bit more lateral near the entrance, I'm just using a fine end tip and just trying to get as much out safely as I can. If anything deeper in the ear, anything 2/3 and further in, we're just going to leave that because it's on the bony part. We don't want to cause any trauma. You can see I'm just mopping up right near the entrance using a fine end. I hope you enjoyed that, guys, and hope you can. Hope that video helps to explain some of the complexities we have, and sometimes why we purposely leave some wax behind. And a bit of wax is not going to be the end of the world. Wax is a healthy, natural substance. I hope you're all having an enjoyable evening, and I shall speak to you all soon.